Hey everyone, and welcome to another deep dive. You know we love to geek out on all things medical, and today we're going full-on baby mode.
Gaby mode engaged.
Uh-huh, exactly. You sent over this fascinating chapter from a medical textbook all about examining newborns and understanding those crucial early checkups, and let's just say my brain is officially overflowing with baby facts.
Well, get ready for even more because we're diving deep into everything from those first few moments after birth to those cute little baby reflexes everyone loves.
All right, challenge accepted. But first, let's set the stage. We've got this brand new little human in our lives, fresh out of the womb. And what exactly are those doctors looking for in those first few exams? It's like they have a secret baby decoder ring.
You're not wrong. Those initial exams are like a crash course in baby decoding, and they're packed with fascinating insights into a newborn's health and development. The textbook emphasizes how doctors rely on careful observation, listening to those first breaths, and checking for any signs of distress right from the get-go.
Okay, so it's all about those first impressions, making sure everything is running smoothly right out of the gate. But let's unpack those initial assessments a bit. What are some of the specific things doctors are looking for in those first few minutes?
Well, one of the most important tools in their arsenal is the APGAR score. It's a quick assessment done at 1 minute, 5 minutes, and sometimes even 10 minutes after birth to get a snapshot of the baby's overall condition.
Okay, the APGAR score. I've heard of it, but to be honest, I'm a little fuzzy on the details. Could you break it down for us? What exactly does it measure, and what do those scores actually mean?
Imagine you're right there in the delivery room, witnessing those incredible first moments of life. The doctor is checking the baby's color, listening to their heart, watching for reflexes like coughing or sneezing, and assessing their muscle tone and breathing effort. All of these observations feed into the APGAR score, which uses a really handy acronym, APGR.
All right, APGAR. I'm all ears. What does each letter stand for?
A is for appearance, P is for pulse, G is for grimace, A is for activity, and R is for respiration. Each of these gets a score from 0 to 2, with a total score of 7 or higher, generally indicating a healthy baby.
So, if a baby scores lower than 7, does that mean something is wrong? Should parents panic?
Not necessarily. It just means they might need a little extra help getting started, like some oxygen or suctioning. But honestly, most babies bounce back pretty quickly.
Okay, that's reassuring. Now, the textbook also mentions another scoring system, the Ballard score. What's that all about?
The Ballard score is like a detective's toolkit, especially useful for those tiny but mighty preemies. It delves deeper into physical and neuromuscular characteristics to help doctors determine the baby's gestational age, especially if there's any question about how far along they were when they were born.
So it's like a baby maturity assessment, figuring out just how developed they are based on these subtle clues. What kinds of things they're checking? Is it like a secret baby handshake or something?
Not quite a secret handshake, but they are looking for clues in all sorts of unexpected places. They examine things like skin texture, lanugo, that's the soft, downy hair. Some babies are born with ear cartilage, and even the creases on the soles of their feet.
Wow, I never would have thought those tiny details could reveal so much. It's incredible how much information is packed into those tiny little humans.
It really is. Now, let's talk about baby skin. We all know newborns have the softest skin, but they can also have some pretty interesting skin conditions that might make a new parent do a double take.
Right, like what's the deal with all those little white bumps on their noses? It's like they have a tiny constellation of pimples. Is that baby acne?
Those are called milia, and they're nothing to worry about. They're just tiny little keratin-filled cysts that usually disappear on their own within a few. Think of them as temporary little pearls adorning your baby's face.
So not acne, just tiny baby pearls. I love it. Now, sometimes babies develop a rash with little red bumps and white or yellow centers. That can be a bit alarming for new parents. What's the story with those?
It sounds like you're describing erythema toxicum, which, despite its intense name, is a common and harmless rash. It usually pops up within the first few days of life and fades just as quickly, usually without any treatment.
Okay, so another harmless rash that's just part of being a newborn. What about those bluish-gray patches that sometimes show up on a baby's back or bottom? Those always make me do a double take.
Those are called Mongolian spots, and they're just flat, pigmented areas that tend to fade over time, often completely disappearing by the time a child reaches school age. They're more common in babies with darker skin tones and are nothing to be concerned about.
Okay, so all those unusual skin markings are just part of being a newborn. It's like a little welcome to the world gift from Mother Nature. Now, moving up from baby's soft skin, let's talk about the head and face examination. What are some of the things doctors are focusing on when they examine a baby's head?
Well, one of the first things they check is the fontanelles, those soft spots on a baby's head that make you nervous to touch.
Right, those squishy spots, they're so delicate, but they're also kind of fascinating. What's their purpose, and why are they so important to check?
Those fontanelles are actually crucial. They allow the skull bones to move during birth, making it easier for the baby to pass through the birth canal. And after birth, they give the brain room to grow. Doctors check to make sure they're the right size and closing at the expected rate, which gives them information about skull development.
So those fontanelles are like little windows into the skull, giving us a glimpse into the amazing process of brain development. Now, sometimes babies develop hematomas on their heads during birth, right?
Yes, a cephalohematoma is a collection of blood under the scalp, usually caused by pressure on the head during delivery. It often looks like a raised lump on the baby's head.
Okay, that sounds a bit scary. What causes them, and are they dangerous?
They can happen during a prolonged or difficult delivery, or if instruments like forceps or a vacuum were used. Most cephalahematomas resolve on their own, but doctors monitor them carefully to make sure they're not causing any problems.
Good to know. Now, the textbook also mentions craniosynostosis, which sounds a bit similar. Can you tell us about that?
Craniosynostosis is a completely different condition, where the bones in a baby's skull fuse together prematurely. This can affect the shape of the head and can sometimes restrict brain growth. Unlike a cephalohematoma, which usually resolves on its own, craniosynostosis typically requires surgical intervention.
Okay, so early detection is really important here.
Absolutely. The sooner craniosynostosis is addressed, the better the outcome for the baby. Now let's move on from those tiny heads to those adorable little ears. What are some of the things doctors look for during an ear exam?
Okay, besides making sure those tiny ears are perfectly formed, what are they checking for?
Well, they're looking for things like preauricular pits, those tiny little holes in front of the ear. Most of the time, they're harmless, but they can sometimes be associated with other conditions, so doctors note them just in case. And of course, they're also paying close attention to the baby's hearing.
Hearing is so important, especially in those early years when babies are learning to process sounds and language. What are some of the tests they use to screen newborns for hearing problems?
Two common tests are the ABR, which stands for Auditory Brainstem Response, and the OAE, or Otoacoustic Emissions Test. They're both painless and non-invasive, and they can help detect hearing loss early on.
Okay, those are some pretty technical terms. Can you explain what those tests actually do? Like, what are they measuring and how do they work?
Imagine you're playing a soft sound for your baby. The ABR measures how the baby's brain responds to that sound, kind of like an EEG for hearing. The OAE, on the other hand, checks for echoes coming back from the inner ear. It's like a sonar system for the ears. Both tests are quick and easy, and they provide valuable information about a baby's hearing abilities.
So if parents have any concerns about their baby's hearing, they should definitely ask about those tests. Early intervention is key when it comes to hearing loss. Now, let's move on from those tiny ears and take a closer look at a baby's eyes. What are doctors focusing on during an eye exam? Besides, making sure those baby blues are sparkling.
Well, they're not just admiring those beautiful eyes. One of the key things they're checking for is the red
A
reflex.
red reflex. That sounds kind of ominous. What exactly is it, and why is it so important?
It's that reddish-orange glow you see when you shine a light in someone's eyes. You know how it looks kind of spooky in photos? Well, in babies, it's a good sign. It tells us the light is passing through the lens and hitting the retina properly.
So if there's no red reflex, that's a red flag. Like
Okay.
something might be blocking the light from reaching the retina.
Exactly. It could signal a problem with the lens, the cornea, or even a tumor in the back of the eye, so it's definitely something doctors take seriously. Now, they also check for things like brush field spots, which are tiny white or grayish-brown spots on the iris.
Brush field spots. What are those all about? Are they something to be concerned about?
Most of the time, they're just a normal variation, but they can also be associated with Down syndrome, so it's something doctors note as part of their overall assessment.
Okay, so it's like another piece of the puzzle
Mhm.
when they're trying to assess a baby's overall health and development. Now, what about strabismus or crossed eyes? Is that something they check for during a newborn exam?
They do. Strabismus is when the eyes don't align properly, and while it's common for babies' eyes to wander a bit in those early months, persistent strabismus can be a sign of an underlying problem and might need treatment to ensure proper vision development.
All right, so we've covered the eyes. Now let's move down to the nose and mouth. What are some of the things doctors check for in that area?
Well, first and foremost, they're making sure the baby can breathe comfortably through their nose.
Right, because babies are obligate nose breathers, meaning they primarily breathe through their noses, especially when they're feeding.
Exactly. So a stuffy nose can be a real problem for a newborn. They're checking for any obstructions that might be making it hard to breathe, and they're also looking for things like Epstein pearls.
Epstein pearls, what are those? Are they like baby teeth but for the gums?
Haha, not quite. They're little white cysts that sometimes appear on the gums or roof of the mouth. They're completely harmless and usually disappear on their own within a few weeks. Think of them as another one of those quirky but harmless little things that babies sometimes have.
It seems like babies are full of these little quirks. Now, what about more serious conditions, like a cleft lip or palate? Are those things they're looking for during a newborn exam?
They are. Cleft lip and palate are structural abnormalities that affect the lip and/or the roof of the mouth, and they can range in severity from mild to severe. Early detection is crucial because these conditions can affect a baby's ability to eat and speak, but thankfully there are surgical procedures that can correct them.
It's amazing how much they can assess just by looking.
Yeah.
Now, what about the neck? Anything interesting going on there?
They're checking for anything unusual like webbing or masses.
Webbing, like loose skin on the neck.
Right. A webbed neck, where the skin is loose and folds along the sides of the neck, can sometimes be a sign of an underlying genetic condition like Turner syndrome. And while most masses in the neck are harmless, any midline masses, meaning those located right in the middle of the neck, would warrant further investigation to rule out any potential problems.
Okay, so they're leaving no stone unturned in their quest to ensure those little ones are healthy from head to toe.
You got it. They are checking everything, head to toe, inside and out.
Well, we've covered the head, face, ears, eyes, nose, mouth, and neck. It sounds like we've just about covered every inch of that tiny little body. What's next on the checkup agenda?
Now it's time to move on to the inner workings. The chest, lungs, heart, and abdomen are next.
Okay, so besides admiring their cute little chests, what are they checking for in that area?
One of the first things they do is listen to the baby's heart and lungs.
You know how doctors always listen to your heart? Well, it's even more important for newborns because they're listening for any abnormal sounds, like murmurs, which could indicate a problem with the heart valves.
Exactly. They're also looking at breathing patterns, making sure the baby is breathing comfortably and without any signs of distress.
And speaking of distress, we know respiratory distress is a serious condition that can affect newborns. What are some of the signs that a baby might be having trouble breathing?
Things like rapid breathing, grunting, flaring of the nostrils, retractions, and cyanosis.
Okay, so let's break those down a bit. What are retractions and what is cyanosis?
Retractions are when the skin between the ribs or below the rib cage sucks in with each breath, and it's a sign that the baby is working really hard to breathe. Cyanosis is a bluish discoloration of the skin, especially around the lips and fingertips, and it indicates that the baby's blood isn't carrying enough oxygen.
Okay, those sound like pretty serious signs.
They are, and if a baby is showing any of those signs, it's important to seek medical attention immediately.
Absolutely. Now, besides listening to the heart and lungs, what else are they examining in the chest area?
They're also feeling the baby's chest to make sure the rib cage is symmetrical and that there are no unusual lumps or bumps that might indicate a problem.
Okay, it sounds like they're leaving no stone unturned. What's next on our head-to-toe tour?
Next, we're moving down to the abdomen.
All right, so what are they looking for when they gently poke and prod that little belly?
They're assessing the size and shape of the abdomen, feeling for any masses or organomegaly, which means enlargement of the organs.
What are some of the potential problems they might find during the abdominal exam?
Well, one possibility is prune belly syndrome, a rare condition where the abdominal muscles are weak and underdeveloped. It literally makes the belly look like a prune. Another is a diaphragmatic hernia, where there's a hole in the diaphragm, allowing abdominal organs to move up into the chest cavity.
Okay, those sound pretty serious. Are those conditions common?
Thankfully, both of those conditions are pretty rare, and it's important to remember that most babies have completely normal abdomens.
That's reassuring. Now, I know this next topic can be a bit sensitive, but the textbook also covers the genitalia exam. Can you walk us through what that involves?
Of course. In boys, they're checking to make sure the testicles have descended into the scrotum, and they're also looking at the placement of the urethra, the opening where urine comes out. In girls, they're examining the labia, the folds of skin around the vaginal opening, and the clitoris.
And this part of the exam is done very gently and respectfully, right?
Absolutely. It's a sensitive area, and doctors are trained to be as gentle and reassuring as possible during this part of the exam.
That's good to hear. Now, moving on from the genitalia exam, let's talk about the skeletal system. I know hip dysplasia is something they screen for in newborns. Can you remind us what that is and why it's important to catch it early?
Hip dysplasia is when the hip joint is unstable, meaning the ball and socket joint isn't fitting together properly, and it can lead to problems with walking and mobility later on if it's not addressed.
Okay, so early detection is key. How do doctors check for hip dysplasia in newborns?
They use two maneuvers called the Barlow and Ortolani tests. Basically, they're gently moving the baby's legs to see if the hip joint pops out of place or clicks back in. It sounds a little strange, but it's a quick and effective way to assess hip stability.
So it's like a little dance they do with the baby's legs, looking for any signs of instability.
Exactly. And if hip dysplasia is detected early, it can often be treated with a simple harness that helps stabilize the hip joint and allows it to develop properly. But if it's missed, it can lead to more serious problems like pain, limping, and even arthritis later in life.
Wow, it's really incredible how much they're checking in such a short amount of time. They're like baby detectives looking for clues to ensure those little ones are healthy and thriving. Now, before we move on to the rest of the checkup, I want to talk about those adorable baby reflexes. The sucking, the rooting, the moro. They're so cute and also fascinating from a developmental perspective. What can those reflexes tell us about a baby's nervous system?
Those reflexes are like little windows into the brain. They're automatic responses that tell us a lot about how the baby's nervous system is developing. For example, the sucking reflex allows a baby to feed, while the rooting reflex helps them find the nipple. The moro reflex, that startle reflex where they fling their arms out when they feel like they're falling, is thought to be a primitive survival instinct. And the palmar grasp, that strong grip babies have when you touch their palm, is another fascinating reflex.
It's amazing how those seemingly simple actions can reveal so much about a baby's development.
Right, and each reflex appears at a specific age and then disappears as the baby's nervous system matures. So if a reflex is absent or persists longer than it should, it could be a sign of a problem and might warrant further investigation.
It's like each reflex is a tiny milestone, marking a step forward in the baby's neurological development.
You got it. And those milestones are just the beginning of our journey through the world of newborns. We've covered a lot of ground with the physical exam, but we still have much more to uncover, from developmental milestones to those rare but important conditions that can affect newborns.
All right, we're just getting started. Get ready to dive deeper into the fascinating world of newborn care as we explore the next chapter in our baby decoding adventure.
Welcome back to our deep dive into all things newborn. Last time we explored those fascinating first exams and uncovered the secrets hidden in those adorable little baby reflexes.
We sure did. And we even ventured into those rare but crucial inborn errors of metabolism. It's amazing how much goes into ensuring these tiny humans get the best start in life.
It truly is a complex and fascinating world. And speaking of complex, let's revisit a topic we touched on briefly before. Neonatal jaundice. Remember, it's that yellowing of the skin and eyes we often see in newborns.
Right, and it's usually just a normal part of the newborn experience.
Yeah.
But you mentioned some cases can be more serious. So what should parents be looking out for? When should they be concerned?
Well, timing is key. If that jaundice appears within the first 24 hours after birth, that's definitely a red flag and warrants immediate medical attention.
So early jaundice, not so good.
Got it. But what about the severity? How can parents tell if it's mild or more concerning? Like, is there a baby jaundice color chart or something?
Aha. I wish it were that simple. Doctors use a nifty little device called a transcutaneous bilirubinometer to measure bilirubin levels through the skin.
Oh, I've seen those. It's like a little magic wand they wave over the baby's skin.
Pretty much. It's quick, painless, and gives them a good idea of whether those bilirubin levels are in a healthy range. If those levels are high, they might need to do a blood test for a more accurate measurement.
Makes sense. So what happens if those bilirubin levels are too high? What are the treatment options for jaundice? Well, in mild cases, frequent feedings might be all it takes. It helps the baby poop more, which is actually one of the main ways they get rid of bilirubin.
Ah, the power of poop. Who knew?
But if those bilirubin levels are really high, they might need phototherapy, where they're placed under special blue lights.
Right, the baby tanning salon.
Exactly. It sounds strange, but it's super effective at breaking down that bilirubin in the skin.
Okay, so timing and severity are key factors when it comes to jaundice. Are there any other red flags parents should watch for?
Definitely. If the jaundice persists beyond the expected time frame, or if the baby's showing any signs of lethargy, poor feeding, or increased irritability, it's definitely time to check in with their doctor.
Okay, good advice. Now, let's move on to another topic that can be a bit scary for new parents.
hmm
Respiratory distress. We talked about some of the signs in the last part, but can you give us a deeper dive into the causes of breathing problems in newborns? It seems like there are so many potential culprits.
There are. The textbook breaks them down into two main categories: pulmonary causes, which involve the lungs, and cardiovascular causes, which involve the heart and blood vessels.
Okay, so it's a two-pronged approach to understanding breathing issues. Let's start with the lungs. What are some of the common culprits in the pulmonary category?
Well, one of the most common is transient tachypnea of the newborn, or TTN for short. Basically, the baby's lungs are a little fluid-filled after birth, making it harder for them to take those nice, deep breaths.
So it's like they're still adjusting to breathing air instead of amniotic fluid.
Exactly. It usually resolves on its own within a few days. Another possibility is meconium aspiration, where the baby inhales meconium, their first poop, during labor or delivery. Not the most pleasant thought, I know.
Definitely not. And what about infections? Can those cause breathing problems too?
They can. Congenital pneumonia, which is pneumonia present at birth, can definitely cause respiratory distress.
Okay, so we've got fluid in the lungs, meconium mishaps, and pesky infections. What about the cardiovascular causes? Those sound a bit more intense.
They can be. One example is valvular pulmonary stenosis, where the valve that controls blood flow from the heart to the lungs is narrowed. This makes it harder for the heart to pump blood efficiently and can lead to breathing problems.
Okay, I can see how that would be a problem.
Hmm.
What other heart issues can cause breathing problems in newborns?
Another example is hypoplastic left heart syndrome, a very serious but thankfully rare heart defect where the left side of the heart is underdeveloped.
It sounds like these heart issues can be quite complex and require specialized care.
They do. And the thing is, the symptoms of respiratory distress, those warning signs we talked about earlier, can vary depending on the underlying cause.
So it's like a medical detective story, trying to piece together the clues to figure out what's causing the breathing problems. What are some of the tools doctors use to figure out what's going on?
A chest x-ray is often the first step. It gives them a clear picture of what's going on inside the chest, helping them rule out things like pneumonia, a collapsed lung, or other structural abnormalities.
So it's like getting a peek behind the curtain to see those tiny lungs in action. What other tests might they do?
Sometimes they'll also do blood tests to check for things like infection or anemia, which can contribute to breathing difficulties. And they'll often use a pulse oximeter, that little device they clip on a baby's finger or toe, to measure the oxygen saturation in their blood.
Ah, the pulse oximeter. It's like a tiny guardian angel monitoring their oxygen levels and making sure everything's running smoothly.
Exactly. And once they figure out the cause of the respiratory distress, they can tailor the treatment accordingly. Sometimes supplemental oxygen is enough to help the baby breathe easier. Other times, more intensive interventions like mechanical ventilation might be necessary.
It's amazing how they can support those tiny lungs. Modern medicine is pretty incredible.
It really is. Now let's shift gears and talk about those amazing milestones babies achieve as they grow and develop.
Okay, from those first wobbly steps to those hilarious babbling conversations, baby development is such a fascinating process, and it seems like those milestones are coming at us fast and furious.
They do come quickly. The textbook outlines milestones across several key areas, from gross motor skills like sitting, crawling, and walking, to fine motor skills like grasping and manipulating objects.
So they're basically learning to conquer their world, one milestone at a time. What are some of those early milestones parents can watch for in those first few months?
In those early months, it's all about those basic reflexes and sensory responses. Think turning their heads towards sounds, tracking objects with their eyes, recognizing familiar faces, and of course, flashing those adorable first smiles.
Oh, those smiles. They melt your heart every time. So what comes next? When do those little ones start to really explore their world?
By 4 to 5 months, they're gaining more control over their bodies. They can usually lift their heads steadily, roll over from their tummies to their backs, and even reach for those tempting toys dangling above them.
So it's like they're graduating from passive observer to active participant.
Exactly. And by 6 to 8 months, they're really starting to engage with their surroundings. They can sit up a support, babble, and coo, and even respond to their own name. It's like they're discovering their own little personalities.
That's so cute. It seems like they're constantly surprising us with new skills and abilities.
They are, and by the time they hit toddlerhood, those gross motor skills are really taking off.
Right, they're on the move. What kind of milestones are we looking for at that stage?
By 12 to 14 months, most toddlers can stand alone and might even take a few tentative steps. And by 15 to 17 months, they're walking well, stooping to pick up those dropped toys, and maybe even attempting to climb stairs, though they'll definitely need some help with that.
It's like they're suddenly little adventurers exploring every nook and cranny of their world.
They are. And their fine motor skills are developing right along with those gross motor skills. By 18 to 21 months, they're scribbling with crayons, turning the pages of their favorite board books, and might even try to use a spoon, though meal times might get a little messy.
Oh, I know all about messy mealtimes. So what about the preschool years, ages 3 to 5? What kind of milestones are popping up then?
At this age, their coordination and independence are really blossoming. They can usually jump in place, throw a ball overhand, stand on one foot for a few seconds, and even hop on one foot. They're becoming little athletes, and their fine motor skills are becoming more refined too. They can copy a circle, build towers of blocks, and dress themselves, though those buttons and zippers might still be a bit tricky.
So much independence. It's amazing to watch them grow and learn so quickly.
It is. And their language skills are exploding too. By age 3, they can usually use 2 to 3 word phrases like want juice or more cookie. By age 4, they can tell simple stories, ask questions, and start using pronouns like me and you. And by age 5, they're having full-blown conversations, singing songs, and might even recognize some letters or be able to read a few simple words.
It's like they're becoming little chatterboxes, soaking up language like sponges. Now, the textbook even provides some milestones for kids ages 6 to 10. What's going on developmentally during those middle childhood years?
The focus shifts from those basic motor and language skills to more complex areas like reading, writing, and math. They're building upon those foundational skills and learning to think more critically and solve problems. By age 6, most kids can speak using correct sentence structure, draw more detailed pictures, and read simple one-syllable words.
So they're moving from learning to walk and talk to learning to read and write. What about by age 10? What kind of skills are they mastering then?
By age 10, they're reading more complex chapter books, understanding abstract concepts and vocabulary, and tackling those tricky multiplication and division problems. Their brains are working overtime.
It's like those little sponges have turned into supercomputers. Now, we know developmental milestones are just guidelines, and every child develops at their own pace. But what should parents do if they're concerned about their child's development?
Don't hesitate to talk to their pediatrician. Seriously, pediatricians are like the developmental milestone gurus. They've seen it all and can help you understand what's typical and what might warrant further evaluation.
They're definitely a valuable resource. Now, while most children develop typically, some face challenges in the form of developmental disorders. What are some of the more common ones mentioned in the textbook?
The textbook focuses on 3 common developmental disorders: attention deficit hyperactivity disorder, or ADHD, autism spectrum disorder, and intellectual disability.
Okay, those are some big topics. Let's break them down one by one. Let's start with ADHD. What are some of the key signs that a child might have ADHD?
ADHD often involves difficulty with attention, hyperactivity, and impulsivity. Imagine a child who can't seem to sit still, constantly fidgets, interrupts others, and seems to be in perpetual motion.
It sounds exhausting.
It can be, both for the child and their parents. Children with ADHD often have difficulty focusing, following instructions, and completing tasks, which can make it hard to succeed in school and lead to social challenges.
So if a parent suspects their child might have ADHD, what should they do?
Talk to their doctor. Early diagnosis is key, and treatment often involves a combination of medication, therapy, and educational interventions that can help these kiddos manage their symptoms and thrive.
Makes sense. Early intervention is so important. Okay, what about autism? What are some of the key characteristics of autism spectrum disorder?
Autism is a complex neurodevelopmental disorder that affects communication, social interaction, and behavior. Children with autism might have difficulty making eye contact, understanding social cues, and engaging in imaginative play. They might have repetitive behaviors or restricted interests.
And the severity of autism can vary widely, right?
It absolutely does. Some children might have mild symptoms and be able to function relatively independently, while others might have more severe symptoms and require significant support throughout their lives.
It's a spectrum, as the name suggests. Now, what about intellectual disability? I'm not quite sure I fully understand what that term encompasses.
Intellectual disability is characterized by limitations in both intellectual functioning, like learning and problem solving, and adaptive behavior, the skills needed for everyday living. It basically means a person has difficulty learning and performing tasks that might come easily to others.
And it can be caused by a variety of factors, right?
Yes, it can be genetic, environmental, or a combination of both. Sometimes the cause is unknown.
Okay, so these are just a few examples of developmental disorders that can affect children. What's the most important message for parents?
If you have any concerns about your child's development, no matter how small, don't hesitate to talk to their doctor. Really, early intervention can make a world of difference. There are so many resources available to support children with developmental disorders.
So true. It's all about empowering parents with knowledge and connecting them with the resources they need to help their children thrive. Now, before we wrap up this part, I want to make sure we touch on chromosomal abnormalities. Remember, we briefly mentioned them in the last part, but there's a lot more to uncover here.
You're right. Remember, those chromosomal abnormalities involve changes in the number or structure of chromosomes. They're like the blueprints for building a baby, and if there's an error in those blueprints, it can lead to various developmental differences.
Okay, that makes sense. So what are some specific types of chromosomal abnormalities discussed in the textbook? Like, what are some of the conditions that can arise from these genetic glitches?
Well, they can be categorized into two main types, numerical and structural. Numerical abnormalities involve a change in the number of chromosomes, while structural abnormalities involve a change in the structure of a chromosome.
Okay, so it's either a missing or extra chromosome or a chromosome that's been rearranged or broken. Could you give us some specific examples of each type?
Sure. Down syndrome is probably the most well-known example of a numerical abnormality. It's caused by an extra copy of chromosome 21, also known as trisomy 21.
Right, and Down syndrome is associated with characteristic physical features, intellectual disabilities, and an increased risk of certain health problems.
Exactly. Another example of a numerical abnormality is Klinefelter syndrome, which affects males and is caused by an extra X chromosome. So instead of the typical XY chromosomes, these individuals have XXY.
Interesting. And how does that extra X chromosome affect their development?
It can lead to things like taller than average stature, infertility, and sometimes learning disabilities.
Okay, what about Turner syndrome? I've heard of that one too. Is that also a numerical abnormality?
It is, but this one affects females. It happens when one of the X chromosomes is missing or partially missing.
And how does that affect development?
It can lead to a variety of things, including short stature, delayed puberty, infertility, heart defects, and certain learning challenges.
Wow, it seems like even small changes in the number of chromosomes can have a big impact on development.
Okay, so those are a few examples of numerical abnormalities. What about structural abnormalities? Can you give us an example of one of those?
Sure. Cri du chat syndrome, which literally means cry of the cat in French, is caused by a deletion or a missing piece of chromosome 5. Cry of the cat. That sounds unique. What are some of the characteristics of this syndrome?
Babies with Cri du chat syndrome often have a high-pitched cry that sounds like a cat meowing. They also typically have intellectual disability, delayed development, and distinctive facial features.
Wow, so it's like the chromosomes hold the instructions for everything, from our physical appearance to our brain development.
They do, and even small changes in those instructions can have big effects.
Okay, we've talked about Down syndrome, Klinefelter syndrome, Turner syndrome, and Cri du chat syndrome. Are there any other chromosomal abnormalities mentioned in the textbook?
Yes, it also discusses Fragile X syndrome, which is caused by a mutation in the FMR1 gene on the X chromosome. It's actually the most common inherited cause of intellectual disability.
Wow, I didn't know that.
Yeah.
How does Fragile X syndrome typically present?
Affected individuals may have intellectual disability, developmental delays, anxiety, and hyperactive behavior. And they often have distinct physical features like a long face, large ears, and a prominent jaw.
Okay, so we've covered quite a few chromosomal abnormalities, each with its own unique set of challenges. What's the key takeaway for parents?
I think the main takeaway is that chromosomal abnormalities are more common than many people realize, and they can have a wide range of effects on a child's health and development. Early diagnosis is important, and thankfully we have amazing resources and support systems available to help children with these conditions thrive.
It's all about empowering parents with knowledge and giving them the tools they need to advocate for their children. Welcome back to the Deep Dive, everyone. We're in the final stretch of our exploration of the newborn world, and today we're tackling some topics that are close to every parent's heart: growth, nutrition, And those little mini emergencies that can pop up when you have a tiny human in your care.
It's true, those early years are full of surprises, both delightful and a little bit daunting. But don't worry, we're here to guide you through it all.
Exactly. Knowledge is power, and we're all about empowering parents with the information they need to feel confident and prepared. So let's jump right in. We ended the last part talking about chromosomal abnormalities. Now let's shift gears and talk about growth delays. What exactly is a growth delay, and how is it different from just being on the shorter side, which we touched on before?
That's a great question. It can be a little confusing. Basically, growth delay refers specifically to a slower than expected rate of growth. It doesn't necessarily mean a child will be short as an adult. It just means they're not growing as quickly as we'd expect at a particular stage of development.
So it's like they're on a slightly different growth curve than some of their peers.
Exactly. And there are a bunch of reasons why this might happen, ranging from underlying medical conditions to nutritional deficiencies or even just plain old genetics.
Okay, so it's not always a cause for concern, but it's definitely something to keep an eye on. The textbook outlines a few different types of growth delays, including familial short stature, constitutional growth delay, growth hormone deficiency, and selected nutritional disorders. Can you break those down for us?
Sure. Familial short stature is the simplest one. It basically means a child inherits genes for short height from their parents. It's totally normal and nothing to worry about.
So if both parents are on the shorter side, their child is likely to be on the shorter side too.
Exactly, it's all in the genes. Now, constitutional growth delay is a bit different. These kiddos are often called late bloomers because their growth spurt just kicks in a little later than their peers. They might be on the smaller side for a while, but they usually catch up eventually.
So they're just taking their sweet time hitting those growth milestones.
You could say that. Now, growth hormone deficiency is a bit more complex. It's a condition where the pituitary gland, which is this tiny but mighty gland in the brain, doesn't produce enough growth hormone.
And growth hormone is obviously important for, well, growth. What happens if a child isn't producing enough of it?
It can definitely impact their growth trajectory. They might be significantly shorter than their peers and might not be hitting those typical growth milestones. But the good news is that if it's diagnosed, treatment with growth hormone therapy can often help them catch up.
Wow, that's amazing. It's like giving their growth a little boost. Now, what about those nutritional disorders you mentioned? How can those contribute to growth delays?
Well, we all know that food is fuel, right? And for growing kids, proper nutrition is essential. If they're not getting enough of the right nutrients, it can definitely affect their growth. The textbook dives into a few key nutritional deficiencies that can impact growth, including protein deficiency, carbohydrate deficiency, and several vitamin and mineral deficiencies.
Okay, so let's unpack those a bit. What's the deal with protein deficiency? I know protein is important for building muscles, but how does it affect growth overall?
Think of protein as the building blocks for your body. It's crucial for cell growth and repair, so a lack of protein can lead to things like impaired growth velocity, muscle wasting, and even delays in reaching developmental milestones.
Wow, so it's not just about building big muscles, it's about building a healthy body overall.
Exactly. Now, carbohydrate deficiency is less common in developed countries, but it can still happen, especially if a child has a very restricted diet.
And carbohydrates are our primary source of energy.
You got it. So a deficiency can lead to fatigue, weakness, and difficulty concentrating, all of which can indirectly impact growth and development.
So it's like their bodies are running low on fuel and they don't have the energy to grow and thrive.
That's a great way to put it. Now, when it comes to vitamin and mineral deficiencies, the textbook highlights a few that are particularly important for growth, including vitamin K and iron.
Okay, I've heard of those. Vitamin K is important for blood clotting, and iron is important for red blood cells, which carry oxygen throughout the body.
You're on a roll. And when those nutrients are lacking, it can definitely impact a child's growth and development. Iron deficiency, for example, can lead to anemia, which can cause fatigue, weakness, and pale skin. It can also impact cognitive development and motor skills.
So making sure kids get enough iron is crucial. What are some good sources of iron for little ones?
Lean meats, beans, lentils, fortified cereals, and leafy green veggies are all good sources of iron.
Okay, so it's all about creating a balanced and diverse plate. And if parents have any concerns about their child's diet, they can always talk to their pediatrician, right?
Absolutely. Pediatricians are a great resource for nutrition advice. They can help you create a meal plan that meets your child's individual needs. Now let's shift gears and talk about something a little less pleasant but equally important: pediatric emergencies.
Okay, everyone take a deep breath. We're going there. Every parent's worst nightmare,
Hmm.
those moments when something goes wrong and you need to act fast. What are some of the most common emergencies parents should be prepared for?
Well, one of the most common and preventable emergencies is poisoning. Kids are curious creatures, and they love to explore their world by putting things in their mouths.
It's true. Everything ends up in the mouth at some point.
Hmm.
What are some of the common household items that can be poisonous to kids?
The usual suspects: cleaning products, medications, cosmetics, plants, even those tiny button batteries that are in everything these days can be incredibly dangerous if swallowed.
Okay, so it's basically a minefield of potential hazards. What are
Yeah.
some key strategies for preventing poisonings?
The number one rule is to keep all potentially poisonous substances out of reach. Store them up high in locked cabinets if possible, and never, ever leave them unattended, even for a minute. And if you're using a potentially poisonous product, like a cleaning spray, put it away immediately after use. Don't leave it sitting out on the counter.
Out of sight, out of mind, out of mouth, right? Especially with little ones.
Exactly. And those button batteries, they're so tiny and can easily be missed. Make sure to keep items containing them, like remote controls, toys, and hearing aids, well out of reach.
Okay, those are some good tips for prevention. But what happens if the worst happens and a child does ingest something poisonous? What should parents do?
The most important thing is to stay calm and call the Poison Control Center immediately. They're available 24/7, and they're experts in all things poison-related. They can give you step-by-step instructions on what to do.
They're like the poison prevention superheroes. What information should parents have ready when they call?
Try to have the substance that was ingested, the amount, the time of ingestion, and your child's age and weight. It's also super helpful if you have the container of the substance handy so you can provide specific information about the ingredients.
Okay, gather all the intel and get those experts on the line ASAP.
Exactly. And remember, prevention is key. A few simple precautions can go a long way in preventing poisonings. Now let's move on to another common pediatric issue that often sends parents rushing to the doctor: foreign bodies.
Oh, yes. Kids love to stick things where they don't belong. Ears, noses, throats. Nothing is safe.
It's all part of exploring their world, but sometimes that exploration leads to little objects getting stuck in places they shouldn't be.
Okay, let's start with ears. What are some signs that a child might have something stuck in their ear?
You might see them tugging at their ear, complaining of pain or itching, or you might notice some discharge coming from the ear. Sometimes there's even hearing loss if the object is blocking the ear canal. And of course, some kids will just tell you straight up that they've got something stuck in there.
I imagine it's tempting for parents to try to remove the object themselves. But is that a good idea?
It's best to resist that urge and leave it to the professionals. Trying to remove a foreign body yourself can actually push it further in and cause more damage. It's best to let a doctor with the right tools and expertise handle it.
Makes sense. Okay, what about noses? What kinds of things do kids typically stick up their noses, and what are the telltale signs?
Small toys, beads, bits of food, anything that's small enough to fit up there is fair game. You might notice nasal congestion, discharge that has a bad odor, or even nosebleeds if the object has irritated the delicate lining of the nose. And sometimes you'll see the little culprit poking out.
Okay, so if you catch your little one digging for treasure in their nose, it's probably a good idea to check in with the doctor. Now, what about the throat? I feel like that one is the most terrifying because if something gets stuck there, it can block their airway.
It's definitely a scary thought. The most common culprits are things like coins, buttons, small toy parts, anything that can be accidentally swallowed.
So what are some signs that a child might have swallowed something they shouldn't have?
They might cough, choke, drool excessively, or have difficulty swallowing. You might hear noisy breathing sounds, or they might complain of pain in their chest or tummy.
Okay, those are some pretty clear warning signs. What should parents do if they think their child has swallowed a foreign object?
Don't wait and see. Seek medical attention right away. The doctor might be able to remove the object, or they might need to do an X-ray or endoscopy to visualize it and determine the best course of action.
Another instance where a trip to the doctor is a good idea. Now let's move on to a less dramatic but still important topic: functional murmurs. We talked about heart murmurs earlier, but remind us again what makes a functional murmur different from other types of murmurs.
A functional murmur is basically just a harmless sound that the heart makes. It's not caused by any structural problem with the heart. It's just a little quirk in the heart's rhythm.
Okay, so it's like a little whooshing sound that's really no big deal.
Exactly. They're incredibly common, especially in kids.
How common are we talking?
Something like 40 to 45% of kids will have an innocent murmur at some point in their childhood. So chances are, if you're a parent, you've probably heard one before.
Wow, I had no idea they were that common. So how can parents tell the difference between a functional murmur and a murmur that might be a sign of something more serious?
That's where a doctor's expertise comes in. They can listen to the murmur, assess its characteristics, and determine if any further evaluation is needed.
Okay, so if you're ever unsure, it's always best to get it checked out, just in case.
Always better to be safe than sorry. Now, before we wrap things up, let's talk about one last topic that's all too familiar to parents: infections.
Ah, yes, the inevitable sniffles, coughs, and fevers. Kids are little germ magnets.
It's true. Their immune systems are still developing, and they're constantly exposed to new germs, so it's no surprise they get sick more often than adults. The textbook focuses on some of the common viral infections that can cause rashes, which can be tricky to decipher.
Right, because a rash can be a sign of so many different things. What are some of the viral infections that commonly cause rashes in children?
Well, there's varicella, better known as chickenpox, which causes that classic itchy, blistering rash. Then there's erythema infectiosum, also known as fifth disease or slap cheek syndrome, because it starts with those bright red cheeks that look like the child's been slapped.
Okay, those bring back some memories. I definitely had both of those as a kid.
They're definitely common childhood illnesses.
Hmm.
We also have roseola infantum, which often starts with a high fever, and then as the fever breaks, a rosy pink rash appears on the body. And of course, there's measles, which can be quite serious and starts with cold-like symptoms and then a red, blocky rash. And then there's rubella, also known as German measles, which is usually milder but can be dangerous for pregnant women.
Okay, so it's like a whole rainbow of rashes.
Pretty much. But thankfully, we have vaccines for many of these viruses, which have significantly reduced the incidence of these diseases.
That's a huge relief. But even with vaccines, kids still get sick sometimes, and it can be tough for parents to know when to worry and when to just let those little immune systems do their thing.
It's true. It's a delicate balance.
Yep.
But I think the main message here is that if you're ever concerned about a rash or any other symptom your child is experiencing, it's always best to check in with your doctor. They can help you determine what's going on and recommend the best course of action.
Great advice. Well, we've reached the end of our deep dive into the world of newborns. We've covered a lot of ground, from those precious first moments after birth to the milestones and challenges of childhood development. We've talked about everything from those adorable baby reflexes to those rare but important genetic conditions, and we've even tackled some of those mini emergencies that can pop up when you're a parent.
It's been quite a journey. We hope you've learned something new and feel more empowered to navigate the amazing, sometimes messy, always unpredictable world of parenting.
And remember, you're not alone. There are so many resources available to support you on this journey. Your pediatrician, your family, your friends, we're all in this together.
That's right. And most importantly, remember to enjoy those precious moments. They grow up so fast.
They really do. Thanks for joining us on this deep dive into the world of newborns. We'll catch you next time.